Lovely.
Okay, hello and welcome to Baltimore Racial Justice Action's first virtual 13th of the month event. Our 13th of the month events usually take place in a variety of locations around Baltimore, and this month we're honored to be welcomed into your homes. Hello again to all our usual 13th followers. Thank you for engaging into another vital and fruitful conversation with us. Our organization is based in Baltimore, but we have tons of followers across the country that are always encouraging us to record and to live stream our 13th events. Well, it's finally happening, and we're happy to have you with us today. We'd also like to offer a special shout out to all of the people that are engaging with Baltimore Racial Justice Action for the first time today. So, we're going to talk a little bit about who we are after we talk about some Zoom features first. Um, so you'll see that the panelist and moderator has video and audio. Everyone else is intentionally has your video off and has your video and your sound off. We do have a chat that is going to open at a certain portion for you all to insert questions there. But just to reassure you, if it's your first time using Zoom, your video and your sound isn't working intentionally. So about BRJA, Baltimore Racial Justice Action is a network of Maryland individuals committed to social transformation with an emphasis on racial equity. We were officially founded in 2003, but we have roots in the Agents of Change workshops that began in 1996. We are a program of Fusion Partnerships, which is a 501c3 nonprofit. So we do our work in three different buckets. So we offer our consultation and our coaching. We're a private organization. We reach out to BRJA and we would do a transformational contract. What that entails is a foundational workshop for all staff, stakeholders, so that could be board members, that could be volunteers. And then after that foundational workshop, an assessment that is happening kind of in tandem would help enforce and give the language on what next steps could look like. So that assessment would include policies, procedures, handbooks, manuals, and then that foundational workshop will help give the language, the history to help inform on what next steps should be. And then we offer the coaching and consultation for staff, board, again, stakeholders, and how to implement those new changes. The second bucket of work that we do is the foundation, is the public workshops for white people and for people of color. Those workshops are 8 weeks long. Typically, they happen in spring, summer, and sometimes spring and fall, and sometimes in the summer. Right now, those workshops are on freeze until we're able to move from our social distancing situation that we're in now. So please stay posted for more information on that. And our third bucket of work is our free monthly dialogues, which you're engaged in now, called our 13th of the month events. Again, these usually happen across places in Baltimore, but we're here with you today via Zoom. So another way, so we offer our website as Be More Anti-Racist / donate for you to become a monthly sustainer or to donate for a one time for this event. As this event is free, usually when we do it in person, the event is free, and we usually have a donation box for you to submit some cash into. So we ask you today to visit our website to make a one time or a monthly sustainer donation so we can continue to offer these workshops with you each 13th of the month. Today is not the 13th. Today is the 11th. We appreciate you all for being on the Zoom on the 11th. What's going to happen is this is being recorded and it will be posted to our Facebook on the 13th. So now we're going to talk a little bit about today's agenda. As you can tell from the topic, it is about self-care and the justice and injustice within the age of COVID-19. Our panelists are going to lead us through three focus areas. The first one, xenophobia, the second, employment, and the third, the prison system. While this is happening, you're able to submit your questions into the Zoom chat. If you look at the bottom of your page, for those of you that are new for using Zoom, there should be a feature that says more. It looks like it has 3 dots. And then there's an option for a chat where you can submit those questions. One of our Zoom specialists is capturing those questions. So I, as the moderator, can see that when it's time for Q&A. We do have a certain allotted time for Q&A. We can't guarantee that we'll get to all the questions, but we do have time to get through a few of those. So our panelists will go through the xenophobia, the employment and prison system, and the impacts of that. We'll get to the Q&A, and then we'll talk about self-care, and we'll talk about action. It's kind of like our last group conversation with moderator and panelists. And then we're going to have time for a closing moment of silence. We'll talk about the importance of that later on, and then the ways to stay engaged with BRJA and follow us for future events. So now it's time to hear from the panelists.
Okay, I will start. I'm Adar Ayera, and I am a primary trainer and a board member of Baltimore Racial Justice Action, BRJA.
I'm Ebony Nicholson. I use the pronoun she, her, hers. I'm a primary trainer with Baltimore Racial Justice Action.
Hold up. Okay. Hi, everybody. My name is Julia Scott, and I am actually one of the 13 of the month coordinators, as well as a trainer with BRJA, and my pronouns are she, her, hers.
And I forgot to introduce myself. My name is Anthony. I am a staff member with Baltimore Racial Justice Action, facilitator and trainer also, and advisory board member. So now the Q&A submission box is open. So participants, as we begin to talk about the event and a question pops in your head, you can place them there, and then our specialist will funnel those through, and then hopefully you'll get to hear an answer to it in our Q&A. So just to reiterate, we want to remind you of how the conversation is going to be framed. We're going to start off by talking about the injustices that we're seeing within these COVID times and what justice currently looks like or what it could look like. And then we're going to spend some time to emphasize at the end what the action can be for all of us and what the self-care is. We're going to continue to encourage you to look out and take account of the privileges that you that exist in your life as an individual, what it means for you as a collective, what those privileges are, and the ways that you may be impacted uniquely and how you can resist and make change, which is something that we're going to implore you to do more while we're doing this via Zoom, because usually when we're having our 13th and we're in person, we're able to do small groups, we're able to sometimes work in affinity groups, and because we're not able to do that now, we're going to emphasize for you to do that work with yourself within this time and even after this Zoom session. Okay,
Thank you.
so we're going to start with our first one, to Adar.
Awesome. So let me start just by giving a short definition of xenophobia, and then sharing why it's so important to frame self-care in this way. So when we talk about xenophobia, we're talking about having a dislike or a prejudice against people from other countries. But let me also say that in this country, the United States of America, it is deeper than that. Xenophobia, and particularly when it comes to xenophobia against communities of color, immigrants of color, is deep within the DNA of our country. And the reason that it is so important to talk about in terms of self-care is because when we talk about self-care in this pandemic, usually we frame it as something that is for the individual. For communities of color, and particularly Asian American and African American communities during this pandemic, it's not just about the individual. It speaks directly to the history of this country and how xenophobia is showing up and showing out during this pandemic. And not only xenophobia, but how anti-Blackness is showing up and showing out since the conversation has become more about the racialized disproportionalities of COVID-19 in the African American, the Black community. So starting out, I just want to say that this is not new. It's not new. We can go back to the Rules of Naturalization Act of 1790, where it really codified America as being for free white people, free white aliens, free white native born to America. Why are we talking history lesson? We're talking history lesson because, again, we have to contextualize what is going on within that history. It does not just impact us as individuals. We carry this feelings of lack of self-worth, which is a stressor during the pandemic because of the ways in which these two communities, Asian Americans and African Americans, are targeted. Those feelings of worth arise because of generations of being othered in the context and in the history and in the lived reality of the United States. It also impacts our sense of security. And what we're seeing now, and specifically Asian Americans, and I want to be clear, I'm not speaking for Asian Americans, I'm speaking from the historical context and where Asian Americans fall within it. That lack of security, that sense that you are now vulnerable, that this group is vulnerable, because we have a resident in the White House who is talking about this pandemic as the Chinese virus. And because we have seen physical hate crimes against Asian Americans exploding. The FBI recorded over 1,000 hate crimes against Asian Americans in a 2-week period. So the sense of self-care and the issues being surfaced around it are not only individual, they're not only familial, but they are also historic. The other thing that I think in terms of self-care, we have to just be cognizant of is the way in which the economics are changing. People are being stressed. So many people have lost jobs. We've had a record amount of people who are applying for unemployment. Any time in our history, every time in our history, when we have hit economic stressors, people who are not white and people who are immigrant and African Americans have been increasing our vulnerability physically, increasing our need for self-care emotionally. And because we're hitting this time right now, we need to be cognizant of it. Asian Americans, this is quite an unusual time in history, because what we've seen is the image of Asian Americans really changed. They went from in the 1800s, early 1900s, of being viewed as this mysterious Oriental type of alien in our country to being model minority. And part of the trajectory of that has been the willingness to assimilate into whiteness norms, including assimilation into the whole concept and lived reality and operation of anti-Blackness. Intermarriage with white people, and Asian Americans have one of the highest percentages of intermarriage with white people. And also the sense of Asian Americans as this model minority, the myth of that. And that model minority myth really started developing between the 1940s through the 1960s at a time when African Americans were, when our movements toward racial justice were being surfaced on a world stage. And the United States of America was saying to other countries, you have human rights practices which you need to pay attention to. And those other countries started pushing back, saying, look at how you're treating your Negroes. And then the myth of the model minority Asian Americans came into play because Asian Americans were used as a wedge and as a protection of white supremacy, because the government, the national narrative became, well, Asian Americans were discriminated against, and look at how they have advanced in America. So it's not racism, white supremacy that is holding Black people back. It is the behavior and the culture of Black people. And as a measure of survival and increased security, a lot of Asian Americans bought into and tried to live up to this model minority narrative. So here we are in this age of COVID-19, where past is prologue. The economic stressors, which now are making more vulnerable these two groups, Asian Americans, African Americans. And I want to just point out here, Anthony and Ebony and Julia, and everyone who is participating in this, that there was a Black doctor who stood at the podium of the president's press conference yesterday and talked about how Black people, their behavior was responsible for the racial disproportionalities of Black people being in contact and infected with COVID-19. So for the message was very clear. For white people, despite their behavior, they're being exposed to COVID-19, and we have to do everything to protect them. For Black people, because of their behavior, they're being exposed to COVID-19, and we have to lecture them about behavior changes. So past is prologue in both of these conversations. Just a little bit of perspective, as I run out of time, 30 seconds. A little bit of perspective is that even though hate crimes have just skyrocketed against Asian Americans, hate crimes against African Americans still are the largest percentage of hate crimes in the United States. And that's just talking about hate crimes. It's not even talking about the government-sponsored hate crimes against African Americans, racial profiling, over incarceration, lack of housing, lack of business loans, lack of medical care. It's not even talking about that. But when you add those things in it, then the numbers go up. The takeaways of this is that when we think about self-care, we have to think about it in terms of the historical context in which we live and how that impacts us, because all of our histories walk with us in our DNA. It's not just about us as individuals. It is about how society is framing us and how they will begin us as a result of the stressors of the pandemic and the economic fallout. Thank you. I'll turn it over to Ebony.
So I'm going to talk to you a little bit about employment, and some of this stuff might be news to you. Some of it just might be a reiteration of what you've already heard. But I want you to take a moment to think about the different organizations or the companies that you work for and the makeup of those companies. So who are in the positions that are building services, are housekeeping, are more service oriented? What is the racial makeup of those individuals? What are their wages? And think about the individuals who work in the higher positions, office jobs, higher wage, higher positionality, all of that. A lot of times, most organizations, they have a high concentration of Black and brown people working in the low wage, service-oriented jobs, and a high concentration of white males working in the office, highest wage jobs for that company. And in this time, we are seeing how that structure is causing coronavirus to be more of an issue for folks who are the most vulnerable and with the least amount of resources as far as finances and benefits go, and how they would be able to mitigate their exposure to coronavirus or managing coronavirus is very different from those who are able to pay for treatment, stay at home, and limit the amount of exposure. And the list goes on and on. Access different types of self-care that are outside of themselves, whether it's therapy or later down the line, when we're no longer doing social distancing, getting massages, things like that to kind of de-stress. Pew Research Center has been doing some really quick turnaround research studies and surveys, and they reported that 73% of individuals with a high school diploma or less are still reporting to work. And so that shows very clearly the class difference between the class education access difference between those who are able to stay at home and limit their access to or limit their exposure to COVID versus those who have to continue going into work because their jobs demand them to be there physically. And we're seeing where folks are being converted to essential employees when they weren't hired to be so, and their pay and their benefits packages don't reflect being essential employees. We also see for those who might be working from home and might be in those positions where they're not necessarily a service job, if they are working from home and their companies did not provide them with equipment like a laptop or a computer or assistance with internet, we have no idea how much households are being stretched at the moment. So something as simple as we're going to be working from home, check in using your laptop. If those folks also have students as children or children who are students, then those kids are also needing to use the internet, needing to use the computer. And if they're a household that had one personal computer, we are seeing where parents have to decide what time do my kids do their education and what time do I do my work, because we have one computer and we have one internet provider, and we already know that internet speeds are different in different communities, and a lot of times low-income communities have lower data speeds but are being charged the same price as the higher data speeds. So just being mindful that even those who are not going into work, it's not equitable, the requirement to have them be the teacher, also use their personal equipment, and be reporting to work and doing their daily duties with the resources that they have at home. Even those who do have multiple computers, having to be a teacher, having to do all your home activities, plus having your children with you is strenuous, and it's going to impact how you function at work. And then who is going to be more harshly scrutinized? We see in the workplace all the time that Black and brown folks are more harshly scrutinized, and that that feedback or those negative observations from supervisors or colleagues can cost them their job. And at this time, people are in need of employment and in need of finances in order to continue buying just the basic necessities of food, keeping their electricity on, things like that. We also see where there's a lot of conversation about people who are essential workers in the hospital. So there's a lot of conversation about doctors and nurses, and they are doing a great job. But we are, not talking about nurses who do not work in hospitals, whose companies are no longer doing home visits, and what that does to them and their access to employment, and that group of people who might be out of employment, and how it is not equal across even the medical field, how COVID is impacting them. Also, there's not much conversation about our cleaning staff, our grocery store clerks, and building services and public transit. A lot of times people, like if you think about Target, I don't know if anybody's been to Target since here in Maryland we had a lockdown, but not every Target has their staff with masks. And some of the employees were told that there are some being ordered, but in the meantime, they could buy their own. And the one employee that I was talking to said that that is difficult for her because she already had her hours cut, and now she's buying food for her family who's staying home all day, and more food is being eaten. She's not sure what the electricity bill is gonna look like because everybody's home all day. The water bill, she expects to spike. And so this idea that just to go and make money, she's also gonna have to buy her own protective equipment is not equitable, and it's not okay, especially when we think about the wages of people who work in retail like Target or at our grocery store chains. And so we see this fight for a living wage is getting exacerbated because now our society is relying on them, but they are also having a hard time supporting themselves based on the income that they had prior to COVID and then the hours being cut. And we're also not thinking about the additional expenses. So I kind of talked about food, water, being home all day, using all your resources at home, your bills are not going to look the same this month as they did last month. But if you are trying to get to work and you use public transportation, here in Maryland, we are on a Saturday schedule every day of the week. And so you might have to navigate getting to work earlier, meaning you're leaving your home earlier in order to get to your job on time, or you're having to use more expensive options like Uber or Lyft or a taxi, or a ride share, which is exposing folks to, any type of ride sharing is exposing more people to potentially contracting and spreading COVID. And so there's more risk attached to going to work. It's not simply just getting to work and the hardships of that. There's all these additional things. And then when you think about people, if you don't work at the grocery store, if you're working at another essential functioning place, there might not be food or resources available at your grocery store by the time you get off from work. And if you are the only person in your home who's buying those things, what is being left for your family? How are you able to provide for them, even if you do have the money? Because we're seeing where a lot of stores, people who can hoard are hoarding. And so there's not much left for folks who might not be able to get there at the time that the truck gets delivered because they haven't been studying it for 4 weeks of when the shelves get restocked. And so we're seeing an inequitable distribution of resources, and it's creating a hardship for the people that we are relying on the most to get this under control, and it's not okay. And we should all be mindful of that. One really great area of like self-care communally is not to hoard, because it means that somebody who's coming later will not have it, and we have no idea who that person is and how they are contributing to society. And a lot of times, if you think about it, it's probably the person who's been working all day, who's coming later, who has nothing. Also, I want you all to think about the fact that it is very difficult to get access to mental health care during this time. And it was before, and it's even more so now, and how organizations are responsible and should be held responsible for providing more access to mental health care for individuals who are working during this time and their families, because the anxiety around having someone going in and out of your home, particularly if they are in like building services or the cleaning, groceries, they're interfacing with a lot of people, they're cleaning up things, that is potentially putting your whole family at risk. And then when we see that a lot of the organizations have a high concentration of Black and brown people in those direct service type jobs, that is far beyond somebody's individual behavior. That's a societal and institutional structural racism at play, and how it is negatively impacting people's lives right now. Providing free mental health care, providing food during shifts. That's one really big area that people aren't thinking about also. If all the restaurants are closed, if all the cafeterias at places are closed, how are people who are working able to eat? That means that they're having to have food delivered. That might be more expensive. If they're not able to get food at the grocery store, that they are more likely to have to get takeout, and it is not cheap. So just thinking about how it's already, if you are a low wage worker, if you already might have been stretching $1, but at this point, even though prices haven't gone up, ability to access things, ability to navigate and get your responsibilities done is costing more money and causing more harm, if you think about it from that standpoint of like anxiety plus having to access resources and having to work around your work schedule. And yeah, I think that everybody who is currently working right now deserves a reevaluation of their benefits package and also hazard pay.
Thanks, Ebony. Before we go to Julia, I would just like to remind everybody that as your questions pop up, you can insert them in the Zoom group chat, and our Zoom experts will help us funnel that into our Q&A. So, okay, off to Julia. Thank you, Ebony.
All right. So one of the things that have definitely come up during the COVID-19 pandemic is the impact that it's having on prisons and therefore inmates and the staff of those prisons. And so public health experts for the last few weeks, obviously between like the Trump, discussions on TV and just local discussions, a lot of public health experts have been calling for people to reduce prison and jail populations to cut down on the spread. And so it's important, I think, when we're talking about the impact that COVID is having on prisons, to talk about it in two ways. So a public health issue and obviously a humanitarian issue. So on the public health front, since our prison systems have been dealing with a lot of issues for a very long time, which is a completely different event to kind of talk about, the COVID-19 pandemic has essentially exacerbated a lot of these issues. So the prisons are at the moment serving as superspreaders of the virus. Due to things like overcrowding, it makes it very, very difficult and nearly impossible for inmates to follow social distancing guidelines, to actually get the help that they need at a time that is going to actually be helpful. And so we are seeing not just inmates, but also the staff that work at these prisons become susceptible to contracting the virus. And more so when people who work at prisons leave and go home out into the community, they are possibly opening their families and their other community members up to get the virus, because they are in close quarters in a place that is not necessarily making it able to follow guidelines. So on the public health front, just talking about it, if we're talking about really slowing down the actual virus, if we're talking about cutting down on people being able to contract the different symptoms, there has to be something going on in the prison to actually allow that to happen. And so, of course, on the humanitarian front, inmates are essentially human beings. I think one of the biggest things that gets lost in this conversation is that we are not just talking about random people in a random place. We are talking about human beings with families and connections and dreams and lives that they want to have outside of the prison walls. And so it's not just the inmates who are being impacted, but their families and their friends on the outside that are also going to bear the brunt of this pandemic. And so the complete disregard for inmates shows a disregard for their humanity and dignity, and the families and the staff of those prisons is the same thing. And so no matter, I think, where you fall on the prison debate, if you will, you do have to, I think, reckon with the fact that human beings are being impacted, and they're being impacted in a way that is not respectful of who they are as a human being. A lot of prisons require that inmates also pay a copay to receive help. So even if they do get sick, I know that a lot of the time people joke that some of the best medical care is actually in a prison. But you know, people do have to pay for that. And it's, like I said, continuously in the public health front, that is exacerbating the issue. So this is impacting not just their physical health, but their mental health. They're seeing fellow people die. They are not being able to be in contact with their family and friends. And staff people, if they get sick, they can't come in. As you know, Ebony just eloquently went over, if you can't pay your bills, if you can't work, like, so this is a larger kind of impactful situation that we wouldn't talk about. And then also, obviously, you know, in prisons and jails, there are nonviolent offenders who honestly could be let go now, because that would cut down on the amount of people that are in the prison or jail, and it will also cut down on jail churn. So less people means that it's less people that could actually get the virus, but because of the prison system and the way that it actually operates, we have not found that a lot of prisons are actually doing that. So across the country, this looks very different depending on where you are. As we kind of get more information about COVID-19 and what is going on in our actual, you know, our home, our local communities, prisons and jail are talked about sometimes as an afterthought. But I have found last week it is certainly being a lot more presence and discussion in the news. And so we have got to remember that there are some people in different states and different governors that are like taking or being forced to take in case a prison has an outbreak, which is happening. You know, so they've been taking like actual steps to let go of nonviolent offenders and then cutting down on prison populations, which is a really good thing, but more needs to be done. So prisonpolicy.org has recommended 5 ways that the criminal justice system could slow down the pandemic. One of the first things is, like I said, reducing the number of people in local jails. And the second thing, reducing the number of people in state and federal prisons. Obviously, you know, like I said, cutting down on those things will hopefully slow down the virus and will allow people to actually be taken care of. The third thing is eliminating unnecessary face-to-face contact contact for justice-involved people. So less people that are coming in or being able to help, you essentially are cutting down on the virus being spread. Making correctional healthcare humane and efficient in a way that protects both health and human dignity. We are already having a lot of healthcare discussions outside of the prison walls. And so I think that we have to remember that a lot of the things that impact us here at home, those things are doubly happening in our prisons and jails. Just remembering that these are microcosms of a bigger issue and what's actually happening outside. And so we are already kind of like dealing with the strain and stress of working from home, or how do we get to work, or, how am I going to pay my bills? There are certain elements of that are also being replicated within the prison walls. And lastly, they recommend, essentially don't make this time more stressful or more profitable for prison telephone providers than absolutely necessary. Like I said, remembering that prisoners are extensions of people outside. And so like, if you want to get in contact with your family member who is locked up, if you want to provide money for your person that's locked up, that's very difficult. So, Ed was talking about earlier about employment, these folks going in prison and really just, looking at her, not efficient, not easy. So everyone's going through the stress. In Maryland in particular, over the last few weeks, Hogan has been kind of brought to the mat about his treatment of people in state prisons. Essentially, a lot of them are doing prison labor. A lot of them are actually making some of the masks and the garments that our doctors and nurses in the hospital actually need to protect themselves, and yet they don't always actually have these garments, these things for themselves. And so it is really important that, of course, I think as we're looking forward to to things that we can do, is to not let up on Hogan locally, or your governor or whomever, about what's actually happening, and to follow the guidelines of public health officials and experts to reduce prison labor, and to essentially let low-level offenders actually go, so they can actually cut down on the spread of the virus. And then particularly, obviously, in Maryland and a lot of prisons across the country, a lot of our prisons and jails are filled with Black and brown people. And so this only just, of course, calls to white supremacy and racism, and continuing all of this, these compacted issues constantly during this time period. So I think really making sure that, I would say, like, for next steps, to read up on what is actually happening in prisons and jails locally, looking at ways that you can possibly assist. If that means, like, hopefully, like, if you know a family that is having issues with getting in contact, helping them possibly through that process, possibly donating to people, organizations that do this kind of work, so that inmates can, get the help that they actually need, as well as talking to local officials, like, during this time period, to push them to actually listen to public health experts and officials. So that is all of my time.
Thank y'all. So it is our Q&A time. Thank you for those of you that have submitted questions into the Q&A. It is not too late. As we're doing this and you think of something, please pop it into the chat. So Julia, Adar, and Ebony, go ahead and unmute yourselves. So the first question that we have in the Q&A is, I want to go to something that this question actually highlights what we had talked about in one of our planning sessions, is the framing of language, that during these times, language can mobilize or halt our efforts. And we've definitely heard language that people have deterred others from using, everything from the way that President Trump has talked about the virus to the way that we talked about the people that have been impacted. What is the importance in language that you see in these times? And what kind of conversations should we be having about switching and altering the language that we use?
Adar brought up a really good point during her section about how, when we're talking about white people and the virus. It's like, protect yourself from it, no matter what. Like, you could get it if you're just talking to somebody. And every time they're talking about Black and Latino folks, it's like, I think the Surgeon General yesterday said, like, don't do drugs and like your I don't know, like your pop and your abuela or whatever. Yeah. And it's like, there's this conversation. And then even Dr. Fauci, like, people were spreading around his little thing, like, we're going to talk about the social determinants of health, and Black people have diabetes and hypertension and they're just unhealthy. And I think that out of context, like, folks are not hearing the social determinants of health. And I think that word is kind of washing away the word of structural, institutionalized racism and how that impacts people's access to healthcare. And why is it that these communities, when we're talking about Black communities specifically, have these health issues? It's not because we're genetically inferior. There's this post that someone sent me on Facebook. It's like, there's nothing genetically inferior about Black people. It is the fact that our communities have been strategically disinvested through redlining, making it difficult for Black businesses to start business in Black communities, incentivizing fast food chains to go to Black communities. So this idea that we as Black people, I'm a Black person, are unhealthy is one that is is very racist. And it's not the same conversation happening when we're talking about white people and this illness with COVID. So yeah, there's a lot of blame being cast on Black people in this story, this perpetuating story of our Blackness being associated with hypertension, asthma, and diabetes consistently.
I was going to say just really quickly that, and also if you're looking at the language that it was used, like I know when Italy was kind of going through all of these, and I read a lot of articles, it was like, oh, well, Italy is filled with a lot of elderly, like, you know, family building, and they're losing all of these people. Very sad loss of era of family, and then like now in America, it's like a very different discussion compared to, you know, how we're talking about other countries. It's just kind of also picking out like the media journalistic value that's also happening.
Language kills, period. It kills in terms of policies, and it kills in terms of just the physical person. So here's the point. That you all know I'm a news junkie, right? That is no surprise to people who know me. So listening to CNN, to NBC, to all of these news shows, the closest they could come to calling a thing was to say structural issues. They did not say structural racism. They did not say anti-Blackness. They didn't say that. What they did say was, oh, I'm so glad that people are talking about diabetes and high blood pressure and all of the things, Ebony, that you talked about. They made sure to say that. Now, here's how language kills. Because when people frame it in that way, what do you think then will happen in terms of policies? In terms of how we decide what resources go to what communities to help people, right, who are dealing with these issues. If the language is, oh, it's just the behaviors of Black folk, then the solution will be, well, Black folk, you need to change your behavior. And that is how policy kills, because it impacts resources. Language kills. Language kills because every time when Trump or anybody else calls it a Chinese virus, hate crimes go up. I was just watching a video that was recorded, an Asian American woman, I think it was in New York, but I'm not sure, maybe someone listening would know this. But she was taking out her trash, and this was like around 11 o'clock or midnight. A man was standing right there and he threw acid on her. She has severe burns now. Language kills. And every time we say Chinese virus, somebody is going to die. or somebody is in danger, physical danger, because in the national narrative, this comes and plays into Chinese people as other, Chinese people as dirty, Chinese people as whatever. And it's not just Chinese people, it's going to be anybody with a certain look that is going to be caught up in that, and that is going to be open game for anybody on the street who wants some retribution. Language framing kills.
It also desensitizes people to death and to the illness impacting these groups of people. So by saying it's a Chinese virus, so if Chinese people are not, people who are Chinese aren't getting adequate medical care when they come in, then it's going to be confirmed. They're going to be able to confirm, like, oh, it's because it's the Chinese virus. And if Black people are dying consistently at higher numbers than any other race, then it's going to be because they're unhealthy. They didn't know how to eat.
Right.
They didn't exercise. They prefer fast food and fried chicken. And so it's just like, by creating these narratives, it sets it up to have an excuse for the subpar treatment and access to medical care that is happening to Black people specifically, where they're not being believed, where they're not getting tested, where they're being told to take a nap when they have all of the symptoms. So that language, it kills, and it kills in a very specific way that confirms the bias and racist actions that healthcare practitioners and policymakers already do.
Yes, it continues the cycle.
Very quickly, because I know we have other questions. This is why we started out with the historical perspective. This is why we started out saying that this is not new, because this is going to get worse as the economic stressors get worse, as people come back and find out that they no longer have jobs, or that they have all of these bills, or, just any kind of stressor. This is something that is historical. And that's why when we talk about self-care in this context, we're saying it's not just about the individuals, that there is a very specific way in which society is negotiating with us as a group, and that we have to be cognizant of that as we look at self-care and ways of self-care.
Yes.
And so this brings the next question, kind of as we talked about the way that it's impacting Black and brown people. How do we spread the awareness and not exploiting people during this time? And can we build awareness without sharing dead Black bodies all over the television screens? And so, Ebony, you had brought this up before during the time and talking about Ebola, and the images that we were seeing were of Black bodies. And then now there's been it's been recent that they've actually talked about the racial disproportionality. It's very much been framed in a way for white people, and we have not been seeing bodies about it. But how do we bring the awareness of the structural racism that's at play, that's going to impact Black and brown people, that is not showing dead bodies on a TV screen?
Yeah, I think I don't 100% know, but I do know, talking about it and showing the direct parallel between how, when this virus was impacting lighter skinned people, specifically started going to Italy, and how we did not see any dead bodies. But when we think about viruses that start in predominantly Black developing nations, how there are very gruesome graphic images, it's clear that we were able, the mass media was able to spread awareness about corona without showing dead bodies. So I would say that we already are on the right path of spreading information about the virus, talking about bias, how it shows up, medical bias, how medical bias shows up, how it might impact Black and brown patients more than it does white people. And so having conversations about how it shows up and the symptoms of it versus showing pictures of dead bodies. And so that is a fear, that now that there are so many Black people being impacted by it, that now we might see an influx of images. And I would like to encourage people not to share images of dead Black bodies, because that is somebody's family member, and you don't actually need to show gruesome images in order to spread information. You can share the story of, if you have a family member, or if you know of a story where someone's case was not taken seriously, share the share the characteristics of why something was handled poorly, not necessarily the specific image, because that in itself is exploitation, and we are not seeing dead white bodies everywhere. And even in our mass graves that we're seeing, we're just seeing the trucks, we're seeing bodies in body bags, and there was not that much humanity expressed or displayed towards the people who died from Ebola. And so when those Nat Geo photographers got their award, they got awards for pictures of people, Black bodies in mass graves and Black bodies in extreme mourning. And so why was that profitable? Because people shared it and people engaged in it. So I want people to be really conscious of the fact that we have found a way right now to spread awareness without showing dead bodies. And I would like us to continue that route of sharing information, sharing characteristics, and not necessarily gruesome pictures.
And I was also going to add that it just it continues that kind of destigmatization of like what we think, illness or what this pandemic actually looks like. If you're only seeing Black bodies, it's like, well, I don't have to worry about this for me. Like, there's not going to be me. So it kind of spreads misinformation, just like with the language piece. So more things that we see in reality, and that's not reality.
Okay, so we have another question that is asking us, that actually cites and says, thank you to Julia about the action that we can take to lean on Hogan re-releasing people from prison, reading up on the conditions, and donating to organizations to which support de-incarceration. What action can we take around the working conditions for Black and brown workers in grocery stores, healthcare, maintenance, etc.?
Well, I've kind of thought about it a little bit. One, there are a lot of people making just the cloth masks. And so I would really encourage, if you are going to grocery stores, if you're going to your local Target and you're seeing that folks at the cash registers do not have a mask, while it's not the top medical grade mask, something is better than nothing. And so your next trip to the store, making sure you pick up additional cloth masks if you have access to that. There are a lot of people on Etsy. There's a lot of people here in the Baltimore area that are making masks. Purchase extra masks for the people that you're buying your groceries, your supplies from, and making sure that they have just a little bit of something to protect them from the people that they're interacting with. And I think you should push your jobs to, maybe they can't increase wages right now, but they could probably afford to provide food and provide grocery pickup for each shift, so people can supply a list of things that they need and like regular household items, and people can volunteer to pick those things up, so that folks who are working shifts don't also have to expose themselves to going to work and transportation, and then also going into the stores. So those of us who are home working, getting in touch with our companies and seeing how we can support the essential workers that are still showing up, whether it's picking up groceries or when we're going to grocery stores, going to the store, taking an inventory and seeing, like, do these folks have masks? Do the people at their home have masks? So if you have access and the ability to even just share a mask with somebody, I think that's a big step in the right direction.
Yes.
Anthony, I would also share this. I think that a danger will be that we talk about things that we can do now, transactional things that we can do now, and that we stop there. That this is going to be over. And when it is, what will we be doing? How will we take the lessons learned and turn that into policy, turn that into livable wages, turn that into to benefits, right? So what are we doing now, and what can we do now to connect with groups who have been working on those issues even before this pandemic?
Yes.
And who will be working on these issues after this pandemic? How do we connect to them, and how do we give our time, our talent, our treasure, to our voices to amplify those efforts? Because this is just one moment in time. And we have to look longer term and longer visioned than the transactional. And I agree with everything that Ebony said about the transactional measures, because we are in this moment and we have to pay attention to that. But we also have, and it's not a but, it's an and, we cannot lose this moment to the moment. There will be a moment after, and we also have to plan what we are going to do then.
Right.
I challenge folks to Google the how that Adar is talking about. Google organizations, look up different organizations that are doing work in the areas of paid sick leave, livable wages, housing, affordable housing, things like that. There are organizations out there, and this is a great time if you're at home and you just have a couple minutes to spare to just learn a little bit more about those organizations that are currently working.
It also, what you said brings up this next question for me that's been heavy on my mind, which is about Black business. And so there, how do you see this impacting Black business and what we can be doing to change, what we can be doing to support our small Black businesses? And so I've seen people encouraging you to buy Black during these times, which is something that we've been encouraging people to do as BRJA forever, to always be buying Black, and something that we should do after this. But how do we see as we're seeing big businesses being proposed to get bailouts and to get all this financial support to be able to recover from this? What's the impact that it's going to have on our small Black businesses? What is the transactional things that we can be doing, and what are the long-term things that we should be looking to be doing?
So I definitely think, every day buy Black, right? And I would expand that and also say, and buy Asian American, because they're really being hard hit, those businesses.
Yeah.
But here's the deal. We know that I think nationally it's like 4.3% of businesses are Black owned businesses. That is a really low number. We know that Black owned businesses get the least amount of loans, right? They get turned down at a rate much higher than white-owned businesses. They get higher interest rates when white-owned businesses get lower interest rates. We know that the system is weighted against them, because when banks are giving loans out, what they're looking for is a fast repayment and maybe a return on investment, where for Black-owned businesses, that return on investment might be slower and might be lower. So the chips are stacked against them, even, from the jump, right? We know that many people who are Black business owners, they have a lower credit or maybe no credit history, which loaning institutions will accept with those low business rates. We know that oftentimes they're in locations that are not the best locations. And we know that they are high touch businesses, our barber shops, our beauty shops, and those are the businesses that have had to close now. And so we are maybe losing Black businesses. So again, what can we do now, to support? And I'll give just a very clear example. I love Zumba, right? And I can't go to Zumba class because that's non-essential. So my Zumba instructor, she's hosting virtual classes, and we are continuing to pay as if we were going to the studio. This is a person with children, with a mortgage, with a house. Nobody has to pay. She's not asking people to pay. She's not telling people what to pay. We're paying according to what we can and to the value that we give to this service. So Black-owned businesses are being extremely creative about the alternatives that they have to remain in business. And we have to be just as creative and just as supportive of them in this time as we are, before the pandemic.
And I'm going to add to it. Someone just said, Adar, thanks for spotlighting how Black businesses, loan practices against Black and brown businesses, and then ask what kind of pressure or how can we put pressure on banks, whether that be something that's short-term or long-term that we could be doing during this time. And I'm opening that up to all the panelists.
Mhm. So
Mhm.
my 2 cents is that we have, again, an opportunity here with the loans or the relief packages coming out of the federal government, right? Let's read those, because when you
Mhm.
read them, you will find out that what is in them is weighted to the people, the businesses that have, and what um, people like us are getting, and I mean just people who we're not necessarily business owners, we're not necessarily high income earners, but we think that, oh, if we get 1,200 a month or 600 a month or whatever, that, oh, it's being it is being promoted as if it is something revolutionary. Well, no, it's not. It's not. Canada's in certain places in Canada, people are getting like a basic income of $2,000 a month through this
Mhm.
pandemic. So let's really read what is coming out of Congress so that we know what to push back upon, and we know what communities and what people are being advantaged through this and which ones are being disadvantaged or just holding steady through this. Julia, Ebony?
I mean, I think that you pretty much said everything that I could have said. I think that this is really the time to pay attention to what is coming on, not just about like loans, from banks, but also I'm seeing like healthcare, like, oh, they are cutting down the price of certain medications. I'm like, they could have been doing that a very long time ago. So it lets you know a lot of the things that they were saying were impossible, but few like short weeks ago are now all of a sudden being made possible. And so it just kind of lets you know that like that was a lie. And so it really puts the onus on us to push back. Granted, a pandemic is happening, but elections, that's a discussion that's going to be coming up. And not just like, the presidential election, but like your local elections are also going to be coming up. Paying attention to what you can do and who you can push and how you can galvanize people in the community who are being impacted is really, really important.
Absolutely. That piece is really important. I think people forget the importance of our local representation and pushing them on issues. And we now have time to, maybe you can't go to your neighbors and get to know them, but we have the internet, and hopefully we are able to circulate different issues and different experiences and compile letters and talk to our representatives on a local, on a state level about the things that we are seeing and the things that we want changed, the changes that have been made during the pandemic that we want to stay because it creates more equity and access to resources for people in our community. So yeah, speaking to our elected officials during this time about what we want to continue and the changes we want to see is really important.
And so I'm gonna start asking questions. It feels like the conversation is going that way too, but moving towards the action and the self-care. And some of it has been said a little bit now, but if y'all could just talk a little bit more about it, or maybe give different examples. Are you seeing examples where steps towards racial justice or just justice at all is in motion? And that could be pertaining to employment, to xenophobia, to resistance against xenophobia, to the prison system, to any of these systems that we've talked about. What are some examples that you've seen that are already in motion that people can go and continue to support something that's already in motion instead of creating something new, or just small practices that they can do within their houses?
So when I think when it comes to the prison discussion is a huge thing that like I will say that I have in the last year or two like kind of joined in like learning more about abolition and ways to make prisons better, because as we know, the system that we have is not working. I think that most people agree that it's not working conducive to most people. And like I said, nowhere where you fall on that debate, I think always reading up and learning more about how our prisons actually operate, who's being impacted, why they're being impacted, is usually the first step. I think that looking into local organizations, I can't name some right off the top of my head, but I do know that like looking into restorative practices and what they're doing in the prison kind of system right now of trying to talk about different ways to reduce harm and looking at crime in a different way. I think talking with local organizations who are supporting inmates' rights and staff's rights in prisons, so they are being treated equitably is really important. But also, I think a lot of it is, like I said, I am still forming my own personal opinions on that topic, and so I think that I'm just joining and learning right now. This is a really good time to, I think, research and read articles and really get the different voices of the debate. So you can kind of form your own opinions, but also looking at organizations that are doing the work. Hopefully, maybe after filming this, we can like provide some links to organizations that are actually doing it and share that on our Facebook page.
Also, we're seeing the humanization of different people in society that have been thrown to the wayside. So we see people who are in jails. One, those of us who have been home for about a month. There are a lot of people who are like, oh, I feel trapped. I think Ellen went on TV that she felt like she was in jail and she's living in a mansion. And so we don't have time to unpack all of what's wrong with that. But just the idea that we put humans in boxes and leave them there for far longer than a month is something that we need to question as a society, the purpose of it and what type of harm we are doing to other human beings in that system in general. That I think this is a really great time to sit and contemplate that as you sit in your houses. Another thing that we're seeing is folks with kids. I'm sure you really appreciate teachers a lot more now because you have the children that I'm sure you love in your house with you all day, every day, and you are just with them. And so the next time teachers want a pay raise and the teachers want better benefits and more equitable resources for their classroom, like all the things that are essential to teaching your children, you should sign on because it is a part of your daily life function to have teachers. All of us have benefited from a teacher most of us have benefited from a teacher at some point in our life. And then a lot of people, I was gonna curse. A lot of people say bad things about people who work in grocery stores, or they think that they're better than people who are in the service industry as far as like delivery people or the people who are cleaning buildings. And those are the people who are saving our society right now. Those are the people who are going places. People don't think about the trash delivery folks. Trash pickup folks, they are still working, they're picking up our trash, and we're probably creating a lot more trash because we're sitting in our houses. So deep appreciation for the folks that are overlooked in our society, whose jobs we did not think were deserving of livable wage and vacation time. I think those conversations are going to come back up. And I think when they come back up, there needs to be more allies not in those fields supporting those groups. It shouldn't just be the union supporting whatever that sector is. These folks are essentially keeping our society running. And so all of us are benefiting from it, and all of us need to sign on and hear the things that they need and the support that they need from organizations that they work for and society in general, and just respect and understanding. But yeah, so that.
Yes.
Well, I would offer this, that we examine how we're showing up, right? That we are so inert in and blind to our own privilege that it is scary. And I'm talking about woke folk. Or folk who claim to be woke. Ebony giving me the side eye because that term. I see you, girl. But the way in which we're showing up, right? We who have the luxury and the privilege of working from home, of still getting a paycheck, of being able to insulate ourselves as much as we can from an increased exposure to this when other people on the front lines cannot. But yet we are talking about how we're bored, how our children are driving us crazy, how we can't get to the barbershop, beauty shop, whatever. How is it that we are so the first place we go is to our discomfort. And the last thing that we see is our privilege.
Right.
But yet we're talking about the external things that we can do while ignoring the practices that we bring to the table. And the other thing I want to offer is this, and it gets back to what Ebony and Julia were saying about the trauma porn, I will call it. You know, I don't know, have you all been on a lot of Zoom calls and go-to meetings? And okay, because this is my life. This is life now. And I can tell you that there was one day when I had like 4 or 5 Zoom calls or go-tos in one day, almost back to back. And there were like a minimum of 7 people on each of those calls. I think the largest was about 15 people on a call. Every meeting, every single meeting, it started out with, well, let's do a check-in. How are you today? How are you handling this? And everybody uses that as an opportunity to go through their litany of privilege. I'm bored. I'm doing nothing but eating. Catch that. I'm doing nothing but eating. You got food. I can't get out of the house. You got a house. You know, my children are driving me crazy. Your children are safe with you at home, right? And so after about like the 4th or 5th meeting, I was sitting there as people were going around. I'm sitting there thinking, wow, I've heard this like 40 times today. And I had to excuse myself from the last call, and I told them why. You know, I was polite. Y'all know I'm very polite. But I told them, look, this has to be part of my self-care. Because after hearing privileged people go through their litany of discomfort, I can no longer take that today. And unlike trauma porn, where you decide whether you want to look at that or not, whether you want to click on that or not, whether you want to read that or not, when you are on a business call, Zoom, GoToMeeting, or just on the phone, you are trapped listening to this again and again and again and again. Because to get off the phone means that you miss the business. So how we show up is something that we can control right now. Right? And our overlooking, being blind to our privilege is an affront to all of those people who don't have the privilege that we in this session are enjoying. And I'm not just talking about us 4. I'm talking about all of the other people who are joining us in this experience too. And not only you, but your friends, your family, and your colleagues.
And it's not to dismiss the hardships that people are facing, but if you are perpetually telling yourself this narrative that you are without, that you are lacking, that you do not have anything, that you are you keep telling yourself all those negative things, you are going to have a much harder time thinking of how you can support others if you think that you are coming from such a deficit. So if you are you could have a lot of things going on. I think a lot of people do have a lot of things going on, but if you are able to access this this session, then there is some privilege attached to it, regardless if you're borrowing a computer and you're using free Wi-Fi to watch it, there is some privilege attached to that. So take some time to step outside of the things that you're lacking and just take a moment to appreciate the breath in your lungs that are working and functioning, because COVID comes for the lungs. And if you are breathing, then you are doing pretty well right now. So that in itself is such a blessing. Your health is your wealth at this moment. And I think people are overlooking that because we have all of our other identities being stripped from us or put right in our face. So if you had a lot of attachment to who you were as a professional, and now you are just a mom all day long, you're just mom, 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 you're like, yo, I am way more than this. This is not for me. Like, that's valid, but also take time to appreciate everything has duality. So mourn the loss of your professional identity at the moment and the ability to escape the demands of motherhood or managing your family, and appreciate, like how Adar said, that you have a family, that you yourself might be healthy, or you're at least not unconscious in a hospital bed. So in this time, it's like it's really important for us to just check in with our blessings or the things that are working out for us right now, because that is also how we're going to be able to see clearly to how we can tap into helping other people.
Exactly. The more we own and acknowledge and examine our privilege, the more we are able to see how we can use that privilege as a tool to help others. The more we focus on our discomfort or irritations, the more power we strip away from ourselves, and maybe the less we will be able to see how we can help others because we're not owning the privilege we have.
Right. I was on that call with you, Adar, and I think that it was awesome. It was hilarious because it was like I think that a lot of us were actually feeling that already, but like Adar like gave voice to it, and so we were just kind of afterwards like, yeah, that was a really important thing. I'm glad she did that. I think that we're all kind of tired of like talking about like I'm just chilling today. So I think that like it gives I think the space for other people to recognize their privilege and to open up and look at things in a very different way and to shift.
My only regret was that I didn't do that at my first meeting, but that I waited to the last meeting to do it. My only regret was my tolerance.
Totally okay.
So another question that I have about self-care, which is something that in this question I see myself in it, is that the media has addressed the impacts of COVID-19 from like a very white middle class frame.
Mm-hmm.
But so while part of me wants to, and I'm watching the news and the current events more than what I usually would, and I've tried to put myself on a diet, you can only watch this much of the news, why we have to stay in the current events and want to know what's happening, because it impacts us so differently now than what it did on a usual basis. How do we do this in a way and staying informed when it's not in the frame of as me as a Black person, and not being framed on the impact that it's having on people of color and only being to one specific group, and with it not having a racial lens to it at all? How do you, what would you suggest if there are sources to people to use, or what strategies would you suggest for that, where it's like, oh, I want to know and I want to be informed, but I don't want to have to go through all of these layers that is not contributing to my self-care?
Well, I would first challenge Black people specifically. The news is not reporting about Black experiences accurately, but if you are a Black person, you probably know another Black person. And so it's really important to check in with the Black people that you actually know, and don't have conversations about what you see on the news. Have conversations about each other, have conversations about other Black people, their actual lived experiences, what's going on, because that's where you will know. Because I've been having conversations with folks. If I took my conversations that I've been having with Black people versus the conversations that the news says I should be having, or like the narrative the news is saying, I am hearing about a lot more Black people being told, I am actually hearing Black people with all the symptoms being told to stay home and take a nap, not do anything further. And the news is saying, like, if you have all the symptoms, you'll get a test. And it's like, that's not what Black people are going through right now. And so I think if you want to stay up to date and current on events, the news probably isn't going to tell you when you're Black what's going on. The people around you in the community that you have will be telling you. And if you don't have a Black community and you're Black, I'm Black, and I will gladly join community with you.
So I think that, we've listened to news sources that are not white media driven. Mm-hmm. There are news sources that are targeted toward Asian Americans, targeted toward Latinx, targeted toward African Americans, targeted toward others. The white-owned, white-normed media is not the only news source. Mm-hmm. And it may be helpful to get off of the CNNs and the NBCs and the whatever, and to connect more with Black media or with Asian American media or Latinx media or whatever, and have that be your primary source of news, along with the family and friends and what's going on in your own communities.
Mm-hmm. I think that it's interesting, like in the beginning of all of this, there was this huge kind of like, it was a joke on one end, but and you talk about, language can kill, that like Black people couldn't get the disease, like the virus, it was like a feeling, oh, it's not about us, it's not, for us. And so, I think that has that set up a very interesting point of view. So like Ebony was saying, talking to Black and brown people, listening to the voices of people who are telling their stories. It's a really cool time for social media, and that people are able to actually speak and talk about what's going on with them. Same way we are watching doctors and nurses kind of like do like, videos saying like how they're reusing their masks. There are Black, workers who are also saying like, hey, I told my boss that this, that, and the other was going on like where I work, and that I deserve hazard pay or I deserve a mask. And I'm starting to have symptoms, they're not providing me care. I think that these stories are not going to always be in the main, in main media, but it's really about looking at your community, because your community, these are people you see every day. And so like, you should be listening to them and figuring out how you can help and assist. So I think that listening to those voices and just kind of getting outside of the news cycle is really, really important.
And so my next question that I want to get to is, sorry, I lost it. There it goes. So this one was from someone asking specifically about, this is moving us a little bit from the self-care, and then we're going to go back to self-care and get a recap from you all. This is going to be kind of like our last question, not pertaining to self-care. Someone also asked about Maryland Immigration Detention Centers, JUFJ, had 2 actions at the Howard County ICE Detention Center, but we have others around the state. What actions can be taken around this?
So I would say, well, first of all, let me be clear. I don't have an answer. Like, I don't have the answer. I have one answer. And that is, I think particularly at this time, and it takes me back to what I was sharing about the sense of worth and the sense of security, and how communities of color struggle with those 2 things, because whether you are Black in America and people who have never been able to assimilate into whiteness, right? Or whether you are like Latinx with white skin privilege, or Asian Americans, or white ethnics who have been able in varying degrees to assimilate into whiteness, only to have it snatched away, like is happening now to Asian Americans as the model minorities. When you are immigrants, you are more vulnerable. So there are immigrant groups in Maryland, the Immigration Outreach Services Center, and others who are working on these issues day in, day out. Again, this is where, what Ebony and Julia were saying about how we can use this time to connect with organizations, even over the phone, or finding out who and what they are. And then connecting with the actions that they feel are important or helpful. We don't have to reinvent the wheel here. We just have to offer and give and stand ready to give support to those groups and those people who have been working on these issues even before this epidemic occurred or pandemic occurred. Julia, Ebony?
I would echo what Adar said. I think that I don't actually have an answer for that particular question. I think that, as I was saying earlier, finding out who is doing or leading those actions, and finding out ways to provide support, pushing on your local officials, I think are some of the things that you can do safely from your home. And then also, we can't, I know that, like I said, if you have a job, if you have, if you are essential, or, you can work from home and you're still getting paid, if you are able to donate money to organizations that are doing this work, that can continue to do the hard work it is of fighting for people, I think that's the time to kind of open your purse, as they say. I think a lot of the time we, when it comes to movement work, I think that we all kind of want to be on the front lines. We all want to hold the poster, and obviously right now we can't do that. But it's, it looks cool, it's great. But I think if you're not able to do that, donating money is great. If you can do phone banking for people while you're at home, do that. You know, like I think there are different ways to get creative and really think about ways to help, and kind of like do your research and make sure you're reading up on those things.
Yeah, it'll come up a little later, but we are going to be collecting resources. So while we as a panel don't necessarily have all the answers and we don't have a lot of the answers, we're hoping that as a community, we can contribute to this collection of information to help people figure out how they can contribute or how they can support in collective action, or just where resources are, how to funnel resources.
Mm-hmm.
So these next few minutes, I want to dedicate to the self-care portion of it. What are you all doing for self-care? Why is it so important to you right now? And are there action steps within your self-care that's like, oh, I want to share with other people, maybe they would want this practice or want to know about this thing?
So for me, I am still almost, I realized this week I let myself not work out in the morning. I was just like, I can't do it. Whatever. I was like in a funk about it. And then I realized this week that my weeks are just better when I continue to maintain that aspect of my routine of first thing in the morning, doing things that give me energy, doing things that make me feel like my heart is pumping, my body is working, I am a working person. Like I'm not attached to any of my other identities. All that I need is within my body. So it's a nice reminder. Exercise, I think some people attach it to losing weight and things like that, but in essence, it's like a way to show yourself that you are functional and that you're here and that there's chaos all around you, but you, yourself, your body, your person, you are a spirit, a person amongst this chaos, but you're still like, you're here. So for me, exercise is really important. And it's nothing like super strenuous. I'm not like running miles. I'm just doing stuff here in my house. And I see where my days that I make sure that I do that, especially first thing in the morning, are much more positive and productive. I don't really have as many like, oh, what was me kind of thoughts. And yeah, so this week was kind of like my control week. I didn't do it and I didn't like the outcome, so.
Wow, okay, so I think one of the things that has been like obvious with a lot of people, I've been doing, of course, a lot more phone calls and Zoom calls with friends and family, which have everything, of course, like I've seen a lot during this time, which has been really, really awesome. But I also think that, when we talk about self-care, unfortunately, that word and that phrase has been like co-opted into like this beauty industry type of thing. And look, if painting nails and doing your own eyebrows, because Lord knows I wish I could, is your thing and is going to calm you, I say go for it. But self-care is also about, like, is this a time for you to maybe focus on some budgeting? Is it a time for me to focus on like my mental health and my physical health? So exercising. Maybe it's a time for me to focus, hey, I don't need to order out all the time. I need to like cook some more meals at home. So really kind of getting into the nitty-gritty, sometimes uncomfortable aspects of self-care for me has been really important. So putting off things that I have been like putting off because, well, I'm at work, and then I have like the gym and I have like all these other organizations I'm a part of. Now it's like I can't go anywhere right now, so I'm at home. I probably should sit out and write this plan that I had been thinking about. I probably should like cook these meals and use these vegetables that I said I was gonna cook with. It's I think looking at it in a way of kind of almost a reset. So that's very helpful for me. Kind of like writing plans, action, what I could be doing. Obviously, getting outside some is really important, and then also the power of napping is really. I had to let myself off the hook this week because I was like, I talked to students all day. I need a 30-minute like nap. I just need a nap. And so it was like before one of my last meetings, I was like, I'm gonna like lay down here for a bit just to zone out. And it was like great because I was able like to jump back into my. I think that it's a quote that's kind of going around about like, you're not working from home. You are essentially like at home working during this like pandemic, during this like life-changing thing. And it's really, really easy, I think, to get caught up in what working from home is. And so we're on Zoom calls all day. We're doing stuff. I think everyone wants to like look very, very busy, like they're doing stuff. But really just kind of taking some time to breathe is really, really important just for your mental health. Because Lord knows, that nap was wonderful. So please, if you can take a nap, do it, because it was amazing. For real.
So I am an introvert, so I was made for times like this. You know, I view this time as found time, and I'll explain what I mean. I agree with Ebony. I think that keeping to a schedule is important. And this
you have an amazing schedule. You should share people your weekly schedule though.
Yes.
Like Mondays are off.
Yeah. So I'll talk about that. So during the week, you know, my schedule is my work schedule. That's it. I have projects that I'm doing, you know, I acknowledge the blessing. And let me tell you, every single day, right, when I sit at my desk at 8:30, just the act of doing that for me is a reaffirmation of the privilege and the blessing that I have to do that, right? Because a lot of people don't. And I have actually found an hour and a half to 2 hours extra in my day, and even more on days when I know that I would have lost a half an hour here, 45 minutes there in travel time. That is found time. And I can use that time to read. I can use that time to study. I can use that time to meditate. I can use that time to work out so that I don't have to get up as early to get my workout in before my work day begins. So it is the acknowledging of the ways in which the discipline of holding that schedule and the privilege of the found time in being able to do remote work. That's a blessing. Mm-hmm. And on Sundays, as you all know, I shut things down. Sundays are my time, my spirit time, right? To examine how I've showed up as a person during that week, to examine whether I've done damage or harm and what repair I have to do in the coming week. It's a time to examine whether I showed up in the prior week as the person that I strive to be and that I'm aspiring to be. So that is my practice day, my reflection day, my accountability day. And because of that, that is time that I have to spend with me, God, my conscience, and my accountability practices. So I practice that before the pandemic, for at least 20 some years. That has been my Sunday routine, or 15 some years, I guess, my Sunday routine. And I see that as something that I will practice for the rest of my life. And, you know, and it is something that I would recommend to everybody. If you can't take the whole day, take part of the day. If you can't take part of the day, at least find a half an hour where you are really guarding that time and just spending it with yourself. That's like my nap, Julia.
Yes.
That spent time, yes.
Also, I think that this time has shown me some things that I needed to release. Some things that were a part of my day that was like either a waste or just not serving me anymore. So like, or more so, not so much release, but like reassess. So I like to journal, but I like had this thing, I wanted to do it every single day. And so then once this started, I was like, yeah, I'm going to journal every single day. And then I finally got to the point where I was like, why do I want to do, like, what am I trying to prove to myself? Like, what functions as a show? And it's just, and so once I released that expectation that I need to write something every single day, now the things that I write are way more quality. They're more reflective of what I'm actually feeling or thinking, or they're just, I don't know, it's just a more enjoyable activity than just like, I have to do it because I said I was going to do it. So I think this is a really great time in the concept of self-care to think about the things that we have attributed a lot of meaning to that maybe are not as meaningful or beneficial to us personally, and developing a new sense of normal and who we are and what we are in this world, separate from the things that take us outside of our home and that like we put on all these different identities. Right now, we are just having an opportunity that not a lot of people get to just figure out see ourselves as just ourselves in our homes, and who is that person? What don't we like about it? What do we like about it? Yeah, I think that it's a eye-opening time to see like the things we are attached to and why. So
yes,
yeah. And so for me, I love cooking, but I didn't realize how much I love cooking and what things I like to cook. My family's Jamaican, so I have been like, Easter is a big deal, and Easter is tomorrow, and I was not gonna not have brunch, like a proper Jamaican brunch tomorrow. And I realized that the world could be ending and I'm having ackee and saltfish on Easter. That's it. That's very important to me, and that's okay, and I like it. So so like beautiful things have been revealed to me as well, like, and I think we should all take some time to just see what's really cool about us, see what's really what we like, and see the things that we're like holding ourselves to that might not necessarily be that.
You know what I hear a little bit of both of you saying, but I really want to surface it in calling a thing, that this is a time where we can really step outside of the adaptive whiteness norm practices that we've acquired. Yes. And really get to reconnect with ourselves, our sense of community, however we find that, the values that we hold, which may be the really taking care of ourselves and slowing down and not feeling like productivity is the only thing or a sense of work of the day, but that just self-care and that inward journey and that doing things, that might not have monetary or product value that we can sell, but which really nurture the soul of who we are outside of a whiteness gaze.
Amen. Yes. I think a lot of the time with myself, one of my life like lessons or purposes, I think, is I can sometimes conflate what I do with who I am. And so like this has really given a lot of time and space for me to evaluate that consistently and like, okay, like I need to end my job today at 5 o'clock. Like I need to cut off. There is no like, oh, I have to travel, and and then Ebony knows, like, I will stay at the office for a very long time, and most of my coworkers always get on me about it. But the reality is I had to have a cutoff time. And so I think I've been a lot more like, I'm done. Like I'm done right now. I'm over it. I'm gonna like go read something or rest or just chill out. I think has been really helpful. So yes, like breaking out of that is a part of what I thought I had to be doing. And now it's like a lot more connecting, like what do I need to be doing for myself? So asking those questions.
Can I talk about one more thing quickly?
Sorry.
And that is, we're talking about like our self-care, but there are other institutions that are really offering self-care specific to children. Like the Reginald Lewis Museum, story time for children. Maybe there are other museums, and they are museums that feed the soul of our communities outside of that whiteness gaze, and where children can go and in the midst of this be children. And it's not like huge gatherings or anything, but children are being isolated too with the lack of historical context or understanding of why this is happening. So I'm really looking around and seeing what types of institutions are supporting our young people who are living in the midst of this too.
Yeah, and reevaluating what it means to be or to feel rested, to feel rejuvenated. It's not always sleep, and it's not always a nap. Sometimes it's an active thing that you need to do, or like releasing a thing that you have been stressing over. I think this time is really showing people we don't have as much control over the things that we thought we did.
Mhm.
So sometimes it's about like releasing the things outside of your control, and you can't fixate on them and continue thinking about what if. So thinking about rejuvenation, not just like rest as sleeping, but like what do you need to release? What do you need to take in more of? What is going to make you feel more renewed, and not necessarily purchasing things or like things outside of yourself, but really trying to figure out what does it look like to be whole and complete for myself.
Yeah.
So I'm gonna thank you, Erica. Put in the comments, ask what I was doing for self-care. I wasn't gonna answer this, but I will now. And I'll give you all a moment to think about like your closing or final thoughts as I'm going. And so I think that mine has been in the beginning when this was first happening and everything was getting shut down and we weren't sure if grocery stores were going to be open and what items were available. I found myself telling myself that I am surviving in the middle of a crisis, and that it's still, even though that hype has gone down, is that everybody is still in crisis mode, and giving myself the grace is that I'm living right now. And even if I don't feel like particularly I'm in crisis mode, everyone around me is in crisis mode. And it's like that you're doing it and that you're still living, and that like you need to appreciate and give yourself grace for that. If you didn't get all of the things that you wanted to get done today, or whatever the thing is that everyone is in crisis mode right now. And that grounds me a lot. The other thing is that as we had talked about, the inventory of kind of like your privilege, but also the inventory of like things that you're like, oh, I need to do this now that I have time for it. And so I will probably about each quarter like go back to what my financial goals are, on what I plan to spend on these things and what I plan to save for. And like most people, you're not spending as much. And so I was like, oh, that's great. But I also coupled that with what one of my biggest worries has been Black businesses. And I'm a person who loves to go to restaurants and eat. And I'm like, what if my favorite restaurants aren't there after this? What if my favorite businesses aren't here after this is done? And so I've made a plan for myself on, okay, this is X amount of dollars that you're going to be able to spend on Black businesses. That is also going to be something that is going to make you feel good, but possibly a product that can be shipped to you, if that's a new shirt, if that's a new whatever the thing is, and it's for a Black business. So it's like this thing that I feel like I don't have control over or gives me anxiety, is like I also have some type of power that I can do, and something that I believe in, and have power within myself to be able to do that thing. So that has been my self-care. I'm gonna pass it to you all for your like kind of final thoughts, and then we'll have some closing.
Julia, what do you think?
Oh, final thoughts. I'm really, really happy that obviously, people joined us today to talk about these issues. As I think that we are like living within a crisis, and really not getting bogged down just with that. I think that we were talking about all these things together, being lost in situations is so important. And so finding ways of getting really care of ourselves, and also make sure we can address the issues outside ourselves in communities that really need it is really important. So I think researching, reading, and donating time or money or your voice is really, really important. And doing that is going to be just going to be pertinent at this time.
Ebony, what do you think?
I hope that everyone just takes some time to call the people that you love, talk to the people you love, be grateful for something as simple but as luxurious as your breath, and the sun shining, and then take it from there and see what else you could do. But I think starting off there of like talking to people who you love and breathing those are really big things right now.
Mm-hmm. And I would offer, first and foremost, take care of yourself. What is it that you need during this time, and to balance your needs with your blessings. Because again, as someone mentioned, everybody on this call has some level of privilege. And if we don't own that, accept that, and then figure out how we use it to make transformative change, then this time and these lessons and learnings will be for naught, because we'll go back to the pre-pandemic way of doing things. The other thing I would offer, and this brings up what you surfaced earlier, Anthony, about Black businesses. Black businesses, Asian American businesses, Latinx businesses, they are in crisis right now, because again, those are the high touch businesses that are not seen as being worthy of skipping through or having a loan process that centers them as opposed to centering the lenders. So if we have stimulus checks in the mail, if we have a little bit of discretionary funds, just figure out how we are going to support those businesses and those people, as well as supporting our families, ourselves, our communities.
And I just want to add to yours, Adara. Michelle had offered this. She couldn't be on the phone today. That even just purchasing a gift card, maybe from a business that's not open or able to ship, and there's something that you can purchase later on, will help them month to month to get by. So
there's also, if you do have the ability and you're still getting income right now, there are a lot of Black and Latinx and Asian businesses that are doing delivery or curbside pickup kind of things right now. They're not necessarily on Uber Eats. I think there's like probably some type of financial commitment that they're not willing to participate in at this time. So just be mindful that Uber Eats and DoorDash and those things are not the only ways to access local foods. And so if you did have a company that restaurant that you used to go to, most restaurants had to let go of most of their staff, but they're still collecting, even if they're not doing food or providing service anymore, they might still be collecting donations for their staff members that they had to let go. So thinking outside of just the fact that you want food, that if you would have spent the money anyway this week, maybe sending it over to a tip jar at one of the restaurants you used to go to, that would be a really good use of your.
Also, local book shops are really important. Books, a lot of them have closed. Read Emma's I Really Miss You and Coffee. Yeah, they're making sure that I think it's called the Bookshop Online. They're very similar to Amazon in the way that it functions, but it focuses on indie bookstores. So if your bookshop already has their own kind of website, do that. But if not, finding ways to support independent bookshops is really, really important this time.
And Libro.fm is like the independent bookshop Audible version, or however I'm supposed to say that. Audible's independent version is Libro.fm. And we're gonna figure out a way to compile all the research. This is a nice, do you mind if I just segue into it?
Go for it.
So we're gonna be collecting a lot of information from you all, and we're trying to figure out the best way to have it on our website, but we will be updating our knowledge and resources in the Baltimore area. If we get other areas, we'll create a section for that too. So if you know of things, resources, community efforts going on, please use this form to fill it out and also share it with your networks. It'll be coming around in an email at the end. And yeah, so any of the information that we have talked about that we know personally will be on our soon to be page, and we will make sure we let y'all know when it's up to date. But you do not need the page to start sending out this link and for us to be compiling information. So if you could do that, that would be a really great way to leverage your internet privilege.
Yeah.
Nice.
Do we want to do something?
Yeah, we're gonna do a so soon Cynthia is gonna put in the link for that survey. Oh, there it is now in your chat. And then we're gonna put in some more links, but we are gonna do a moment of silence. And so it's very easy for us in this time to talk about post, like what's happening for us right now, and post what's happening. And we talked about like our privilege in this. And so we also want to acknowledge that, like, as we are having this conversation, that people are dying. The people have been, that COVID-19 has been, I would say probably in the last few weeks, really gotten our attention in making us stay home, but people have been dying before that, before it got this mainstream attention. And that even after today and after this phone call, more people will be passing away. So we wanted to take a moment of silence for that, and we're going to do that for about a minute, and then we have a few more closing announcements before we end this Zoom call. Thank you. We as BRJA send in positive vibes and thoughts to all of you that have lost loved ones, or those who have loved ones that are in the hospital or quarantine as people positive with COVID-19. Thank you for taking that moment of silence with us. So a few closeout announcements that we want to make. So again, we're able to offer these free 13th events to you, and we would ask that you could make a donation to us at the bemoreantiracist.com is our website /donate. Cynthia is going to plug that into the chat. And then you can also follow us on Facebook to learn about future 13th events. It's very likely that we're going to be on Zoom again, that we won't be finished this social distancing time. But we don't have the topic yet for the 13th event, but you can follow us on Facebook to learn more about that event. And then you can also go to bemoreantiracist.org, just to our homepage. And then on our homepage, you can sign up for our listserv. You'll see it at the bottom where you can add into your address. And then there is a listserv there, so you can get all the updates, whether that be for 13th events or upcoming public workshops. All BRJA correspondence you can find there. Any other last thoughts from our panelists?
Thank you all for joining us today. And it has been a pleasure to be with you, Anthony and Ebony and Julia.
Yes.
Thank you. Yeah, and thank you all for tuning in. I didn't expect so many people, so.
Yeah.
Cool.
Yes, thank you guys for joining us, and we hope to see you for some other events that we have Zoom or hopefully one day outside of Zoom.
Yes. So don't forget the WooFoo. Don't forget the links that we put into the chat, please. And we want to give a special thank you to our Zoom specialist team to help us make this happen as seamlessly as possible. Thank you all for doing that. Much appreciated. Enjoy the rest of your Saturday. Stay safe.
Anthony, one question. Someone was trying to reach me. So you can reach out to BRJA and they will get your message to me.
Yes, you can email us at bemoreantiracist@gmail.com.
Thank you.
Yes.
Thanks.